Welcome to Oh My Mind, the podcast where we talk about mental health with heart, humor, and expert insights. Whether you're navigating anxiety, learning about therapy, or just need a space to feel seen, this podcast is for you. Join me along with mental health professionals and real-life voices as we dive into battles of the mind and how to overcome them. Welcome to Oh My Mind, podcast where we talk about mental health with heart, humor, and expert insights. Whether you're navigating anxiety, you'd like to learn more about therapy, or just need a space to feel seen or heard, this is the podcast for you. Well, on today's episode, we're going to be talking about the basics of mental health. So, what it means to seek professional help, when to know when you need it, who to see, and also what to expect from seeking professional help. And we have a special guest today. I will let her introduce herself. She wears many hats. I've known her for many, many years, but I want her to do justice to her intro. And Melissa, please introduce yourself. Do not be humble. Yeah, just take it away.
Thank you so much for having me. So my name is Melissa Kioko. I am a therapist. I am a trauma-informed therapist. I have been a therapist. It's going to be 5 years now. Crazy, I can't believe it. I'm just a girl.
Yeah.
But and I'm also really, really passionate about teaching people how to take care of their mental health. So I also create content on social media around the same. And I mostly deal with trauma, grief, addiction, and just general mental wellness. Was that good?
That was good. You can see the other things you do on the side, but it's okay. That's for another time.
Well, I am a creative. I am a creative. I think that's when we knew each other in high school.
Yes.
I am a fashion designer. Hopefully going to go back to that soon. But that's actually something that I've been trying to do more in therapy. Bringing more creativity, art therapy, just having fun with it.
Yeah, you just reminded me. It's like, wow, you would do the designs. I would model. It's like, wow.
I know, it's coming back.
It's coming back.
Hit you up.
Oh, wow. Yeah, I love it. And I love to see you here. You've said it's just been 5 years. But honestly, when I look at you and I look at your space and, the presence that you've created online, it's like you've become such a force to be reckoned with. That's what I can say. So good job. You're doing well.
Thank you.
So Melissa, what inspired you to become a therapist? And also, how has that journey been like?
Oh, wow. This question, I always have a hard time answering it because, to be honest, it was my own grief that inspired me to be a therapist. Really? I wanted to go into research, academia, and honestly, I didn't think I was going to practice. But also that's because the university wasn't prepping us to practice. It was more of other things. So I was going through it. My friends were going through it because we lost someone who was close to all of us. So I was just like, okay, I studied this thing. How can I be of help to myself and to the people around me? So I started practicing actually in government clinics before I started my practice. Yeah, that was my first job. Crazy.
Crazy. How was that like?
Oh my God.
Yeah.
It was good experience, but I think it was just not fulfilling for me. And also I enjoy being a business owner. From literally having a fashion business, I enjoy being a business owner. So it was my own struggles and my friends, and I decided to maybe let's create content. At first I was like, let me see, and then people started making inquiries so do you see clients and everything, and then I just switched to my private practice, and it's been honestly a beautiful 5 years since. Of course there's ups and downs. It's heavy work. It's very heavy work. Imagine. I've learned how to rest, learned how to prioritize myself, but I love it. Honestly, I love my job. I love my job.
Oh, that's wonderful. Actually, I can already imagine the mental load that it comes with. Let me just ask, how do you debrief so that you don't carry all these things that you get from the clients you see, the situations, the different things that you deal with?
Boundaries. So I also talk to my clients about what boundaries look like for me. My availability. So I try not to just be constantly working. In fact, for the first time, in a while. I took like 10 days off without working. Usually I'll travel and work while I'm away. Now I'm just like, So I'm still learning. To be honest, I'm still learning because also like people think we forget about client stories. No, they stay with us, you know. So it's also like a mental like boundary of like, okay, let me not think about this client. Let me not try and figure out this case. Let me, you know, so it's intentionally resting and having like very serious boundaries. But for me, decompressing is always travel. I'll hop on like the next trip. Just to get away from my environment and
Okay. Do you ever feel like sometimes you may want to do more for a client beyond the therapy that you do? And then like, how do you also tell yourself, hey, I need to stick to my lane?
Of course. One thing as a therapist, you have to remind yourself that it's a client who's doing the work. You're just helping them. You're facilitating the process. But all the time, oh my God, come here, I have to give you a hug. Definitely. Therapists are human. Like everything I hear like stays with me, and and also like it's important to have a supervision and a therapist as well, so that you also have people that you're talking to, professionals that you're talking to.
So the therapist has a therapist as well.
Yes, like a whole chain. A therapist has a therapist has a therapist.
So you're all helping each other somehow.
Exactly.
All right. That's good to know. So now let's get into the beef of it. How would you describe mental health? When I ask you what is mental health, because now, actually, let me tell you why I'm asking this. Because I mean, it's sort of become a buzzword, or we're talking about it more now, and as much as we're talking about it, there's also sort of like the misuse of it, and we don't really get maybe the difference between mental health struggles or mental health illnesses. And then someone will just say, we are on mental health. And it's like, what do you mean we are on mental health? You know? So how would you define mental health?
I usually feel like pinching people who say that. Mental health. My goodness. So that's actually a lovely question. I feel like the last time someone asked me that was probably in uni days, and I wish people asked more questions. The basic definition of mental health is your psychological, social, and emotional well-being. So emotional in terms of how you deal with your emotions, how you feel, regulate your emotions. Psychological in terms of your thought processes, things that have happened to you. Social, your sense of belonging, the people around you, the relationships that you have. And now all of these three affect how you think, feel, and behave. So everyone has mental health. The same way everyone has physical health.
Yes.
Right? And then when you get sick, you have a physical health condition.
Yes.
Right? So everyone has mental health. It's just about maintaining good mental health.
Okay. That's good to know, because I'd say for me personally, I don't want to say I was ignorant, but to be honest, I think that's what it was. I didn't really bother to actually find out like what this really is until I had my own experience. That was it was quite bizarre, let me say that. I had an experience with a very bad panic attack. Ended up passing out. It was just like a crazy experience. I've talked about it in an episode.
So sorry.
Thank you.
It must have been scary.
Oh no, it was the most most scary experience.
Is always like...
I was like, what is happening? And you know that feeling of like, I'm going to die? I don't know why that's the thought that, you know, comes to mind. It's crazy. It was really, really bad. And I felt it like, of course, there was what was going through my mind, and there was how I was feeling physically. It was crazy. It was a pandemonium. I was throwing up. I was like, don't know what. I'm crying. I can't control the cry. You know, all that. I ended up in hospital, and then that's when they're like, okay, she seems to be stressed. So they were asking the people around me, like, has she been stressed? Or like having a stressful period, because at that time I wasn't too coherent. Like I couldn't exactly express myself. Then I eventually, when I was able to, so now when we're talking with the doctors, and then they asked me the same things, have you been under like a lot of pressure and stress, which I had been around that time for like a couple of months. But then they referred me to a psychiatrist after, and then this is when I was like, wait a minute, what is this? What just happened? Yeah, what is going on? And I went back home and I went to my friends. That's when I was like, oh guys, so I had this thing happened, like this panic attack. And then now we start talking, and that's when they also start saying, oh yeah, I also have like anxiety. I've gotten also anxiety attacks before. And I'm like, you guys have what? What do you mean? But I'm like, first of all, how is it that we've been experiencing these things but we don't talk about it with each other? There was that first. But then now there's also this many things that I'm hearing. Now I'm learning. I've been told by this doctors, that was a panic attack. I'm hearing also anxiety attack. And I'm learning also that they're different. And then now I go and see the psychiatrist and they diagnose with generalized anxiety disorder. And I'm again like, these are big words, and there's just a lot happening. But so what I realized, like from before, I was coming from a place of ignorance, but because I had not experienced it and I didn't have anyone close that I knew of who had experienced it. And so maybe we could ask, like, what are some of the things that can trigger such an experience, like a panic attack or an anxiety attack? And
okay, I'm so sorry about your experience. Sorry.
Thank you. I'm good. I am good. It was like 2019, so a few years back. Now I have, like, I can say I have the tools to to get to that place.
I usually feel like people become more conscious or aware of their own mental health when, like, either the people around you or you yourself start having like challenges, which is quite interesting. But it's like
we didn't talk about it until it blew up.
That's true.
Until it became, and I'm like, what do you mean I've ended up in a hospital and being sedated and all those crazy things. So but that's the only that's what it took for me to learn. And so
back to your question. So mental health conditions are very complex in terms of what causes them. So there's not like one singular thing that you can say causes like mental health conditions. Like, for example, you may be genetically predisposed to depression, but then exposure to ongoing stress and like just the global issues makes you now like actually develop it as a disease or a condition. So as an illness, so there's biological factors. So biological factors is now like the genetical factors, chemical imbalances, neurological differences as well. And then now there's environmental factors. Think of your environment, all the stressors that you're predisposed to, trauma, heartbreak, all those things, right? So those are environmental factors. So everything around your environment. So it's a myriad of all those things. And one leads to the other, sometimes the other leads to the other.
So we've mentioned something interesting, like being genetically predisposed. So like, just expand on that a bit. Just a bit.
So like your gene expression actually sometimes, like you see, I'll give even a perfect example, like bipolar. More often than not, even when a bipolar diagnosis is being done, it's probably running in your family, because all of these, the same way, yes, this is a perfect example. The same way diabetes can be genetic, it's the same way bipolar can be genetic. So just your gene expression carries that disease. And then now, actually, we can just use diabetes and bipolar. So you see, the same way with diabetes, like you may carry the gene, and then through management and support, like it stays maybe dormant, or you're fine. It's the same way with like bipolar as well. Now you need to have it diagnosed early, or sometimes it doesn't even actually like present as fast. So it depending on all the environmental factors that you're exposed to. But I think people need to see mental health issues just the same as physical health issues. It's just that they manifest differently, but it's the same way you could be genetically predisposed to a lot of things. And I always tell people to go back to their family history and everything. You know, the uncle who was called crazy, more often than not, it's like was a schizophrenic person, and then you may find that it's like been going on in like the family tree, but then because I guess lack of language and knowledge, you just think they're not okay.
They're crazy, yeah.
But then it's genetics.
Oh, okay. Interesting. Would it be right if I said that the psychological and what's the other word that you mentioned? Environmental can trigger the genetic predisposition?
Yeah, so like if you are already genetically predisposed and your environment is not suitable for your mental health, and then you're also experiencing psychological differences, and of course you will
they can trigger
so that's what I'm saying. It's like a cycle. Each arrow points to the other.
Okay, that's actually very interesting to learn.
But not everyone is also genetically predisposed.
Not everyone. Okay. And is it also right that you might actually just present this, I don't know, do I call them symptoms? And you are not genetically predisposed?
Definitely. That's what I'm saying. Like it could be a mixture of all, or it could be one. It's complex. Complex. So you can definitely like maybe have gone through trauma, and then now you start experiencing like depressive symptoms, anxiety. You could have gone through even like, let's say, childhood trauma specifically, and then now you develop complex PTSD, and complex PTSD presents like differently. So you may feel like you're depressed, you may be avoiding certain things or having unhealthy coping mechanisms, but it's just being traced back to your childhood trauma.
Okay, let me ask, actually, can drugs and substances also trigger?
Definitely. You're doing great.
I'm doing great. Good. I'm a good student.
Actually, it's so interesting. I've been when I was working in government clinics, the one thing that we started seeing a lot of is like drug-induced schizophrenia, and a lot of it is like you smoke weed and maybe you don't know like the actual source and everything, and then you end up having like a manic episode. So some things are actually like drug-induced as well. And there's a lot of research on that too.
Oh, okay. You know, that has made me think. I don't know if you may recall, like let me see, kitambo kidogo, like in our younger days, you'd probably hear our parents say, if you smoke weed, you'll go crazy. And then if you meet someone who's acting in a funny way, they say is in bangi zake, you know, this kind of things. And so I was starting to realize that maybe this person probably even just had like a puff or something, and then it triggered something that they were already genetically predisposed to. But then now the direct correlation was just made that smoking weed will lead to, you know, I don't want to say craziness, but that's the term that was used.
Like mania.
Mania. That's the right term.
No, it depends on what this they are. It depends, but it's an easier. It's softer than saying crazy. And that's very true. That's very true. And it's not just even about like what people are smoking. Like it's not just bangi. It's also like you don't know. It could be like laced with something. Or there's so many things. So it's not just weed does this. It's a lot more complex than people simplify it.
I think we're making it like a slippery slope. Just
smoke weed.
And that's where you'll end up. And that's not necessarily the case. There are a myriad of factors that have played into someone.
And I think that also contributes to the stigma, like just calling people crazy. And it's like, why?
Wow. Okay, I think, I already feel like my mind is it's shedding so much light into things that we also take for granted, that we maybe never saw them like that. But thanks for you know, shedding light on that. So I wanted to ask something like, what would be the telltale signs of someone maybe who's going through mental health condition? Do you say mental health condition, or is struggling with their mental health? And I'm saying this because just from what I've shared before, when I had this full-blown incident, but now when I looked back is when I realized, this was actually coming. This was actually coming because I remember around that time, I would be very restless, even when I'm trying to rest, and like I'm just very restless. But like you can't put a finger to it, and then we say, sijui ni nini, ama like nasikia sijui aje.
Basically. Yes,
I don't know how I'm feeling. Because you really can't put a finger to it, and also as I said, I had no idea. I don't know. All I knew is it's stressful, but also the way we've been conditioned is that you just go through, you just push through, you continue. It's stressful at work, you continue. At home, it's stressful, you just keep it moving, because also the world is not waiting for you. But what could be like what could be the telltale signs that something is off?
I like that question again. I like that. Like, honestly, it feels like basics of mental health, but it's not basic because like we actually don't have conversations about these things. So going back to the definition of mental health, we talked about how it affects how you think, feel, and behave. So just in the same way, so if your mental health is not like doing A-okay, then it'll affect all those things. So let's talk about thoughts. So like if you're experiencing suicidal thoughts or even homicidal thoughts, and actually by there lots of criminals need mental health support. For sure. And then overthinking, anxious thoughts, like you're having maybe a repeated like thought, like you're just staying on one thought, constantly maybe catastrophizing. You're just thinking of like, this is just gonna be bad.
Worst case scenario.
Every day, I just so like any thought pattern that doesn't feel like healthy, basically. And then now how you feel. So like maybe persistent sadness, like you're just persistently sad, or you're feeling numb or dissociated, like that definitely can like signal like there's something going on with your mental health. And then now how you behave. So now you see like the erratic behavior that you may see and call crazy, like that definitely someone who requires mental health support. Or maybe you don't want to spend time with people anymore as much, or you're like all of a sudden you're isolating, you're not doing the things that used to bring you joy. Your behavior has definitely changed from what it used to be, and maybe even just the normal standard for you. So I usually say just think of those three things and you'll be able to see. And then it's not even just externally, sometimes you're also having like self-depreciating thoughts about yourself, and you're feeling bad about yourself, and then maybe even now behavior wise you're maybe harming yourself. So coping by drinking, sometimes in like other situations like self-harm. So just think, feel, think and behave.
Feel, think and behave. Okay, interesting. You've mentioned something and I was just like, wow, that is so me. The isolating thing. Now that I am more aware, when I start isolating, that's when I know
no, same. When I feel like let's talk to my therapist.
I'm like, I need a session soon. And I'm already I'm an ambivert, but I have like an introverted side, so I already spend quite a lot of time by myself. But there's a difference between like when you're just in your solitude and when you're isolating,
when you're intentionally isolating.
It's like you're actively avoiding people, social interactions, and if the way you're saying the things that bring you joy,
you stop doing them completely.
You stop doing them. Okay, all right. So now that we have a bit more information on like mental health, and we're really talking about it, which is good.
Lovely.
I love it. I love that we're talking about it more. But now I've just been wondering, do we have a scenario where we actually have more cases, or is it that we are just more aware and we're talking about it more? But I also ask this because I was listening to a podcast episode by Trevor Noah, and oh Lord, I've forgotten his name. I'll insert it here to be inserted somewhere. But they were talking about how mental health cases amongst young people have of course, have become more in the recent years, and they were trying to draw some parallels with some of the things that could have caused it. And we also have things like the use of gadgets, there's social media, there's, you know, these screens, there's so many things, and also just like the circumstances that we live in today globally. So they're just like actually quite a number of things, but it's also, especially now when it comes to social media, it's how it shapes how we interact with people that we also don't know, but also it sort of also affects how we interact offline. But yeah, so I've just been wondering, like, is it that we actually have more cases, or are we just more aware? And how do we also show that we are just not more weak? Because we have this thing for, you know, there's been this thing like, okay, you young people, you just like trivializing everything, and you know, your anxiety or depression and
that's
stuff.
Nonsense.
I
honestly like quash any thoughts of like weakness and mental health struggles, because like, would you say someone with leukemia is weak? You know, like people with physical health challenges actually receive a lot more compassion, empathy and understanding than people with mental health struggles, because you're not weak, like it's part of your body. It's just really saying no, you know,
and you can't really control it.
You can't, you know, you can just manage and get through the other side. Same with any like physical health condition. But I think it's also like a little bit of both in terms of, are we seeing more cases or do we have more awareness? Because definitely a lot more people are feeling open about talking about their mental health struggles. So we're going to see it as, you know, many people. But then at the same time, here's the thing, like life hasn't gotten easier as well.
Yeah, that's true.
Right? So there's global stress. This is just like it's global stress. Everyone is exposed to multiple stressors. So you're definitely going to see a lot more like mental health conditions. But then again, also because of the awareness, now people have language. So you may find that someone who was suffering in silence before now is able to speak up. That person has always had a mental health condition. It's not that now all of a sudden, it's just now they have language to say, actually, I've been depressed. So I think it's a little bit of both. Yeah,
that's interesting. The way you're saying, I mean, the world has changed and it keeps changing and it's becoming more complex. And so, of course, there's more pressure. There's a lot of competition as well. There's a lot of comparison. There are just so many things.
Too much.
You know, it's too much. It's too much. Then throw in capitalism. There's actually quite a lot. So, I mean, I see how, of course, those could already exacerbate it. But now the fact that we're actually talking about it more, and now people feel like it's safe to even just speak out and say, and share and say, okay, you know, I've also been struggling with this and that. However, I'm seeing, you know, there could be where you're actually struggling with something, and then now there's also the other adverse part where it's an actual illness. So how will I know the difference between I'm feeling anxious and I actually have an anxiety disorder, or I'm feeling very sad, it's like very, very sad, and this is actually depression. You know, and then also now this one, how I think with how we label it or misuse, I'd say misuse to some extent. You say someone has mood swings, but what's the difference between just mood swings and bipolar? You know, those, like it's like a spectrum to some extent.
It definitely is. You can even use the anxiety example. You can be anxious but not have an anxiety disorder. Right? And stress is normal. In fact, little bit amount of stress is good because it actually helps you to get to the next level. Because whenever you're stressed about something, you're like, okay, let me figure out the solution. Right? But then now when the stressors, one, are consistent and constant and never ending, and you're also not able to handle it. When you're not able to handle it, then now you're definitely experiencing higher levels of anxiety, for example. And then there's also clinical assessments for all of this too, which have made our lives easier as therapists. But so when you're experiencing like anxious symptoms of overthinking, for example, or you are in a freeze response where you feel like you can't even move, you can't do anything, or you're experiencing panic attacks, for example, and then now you can actually be diagnosed with an anxiety disorder. And also with being diagnosed doesn't always mean you have to be on medication, right? Because even with the assessments, there's like, if you get like, 5 out of 10, then we'll be like, okay, not 5 out of 20. We'll be like, like, let's manage it in therapy, let's talk about it. But then let's say if your score is like 15 upwards, then you may need a mixture of both therapy and medication. So it also depends on the specific things that you're struggling with, because anxiety presents differently for different people. There's people whose anxiety manifests in just up here, their thoughts, and they're constantly in their head. There's people who now it gets to their body, so like somatically, panic attacks, like what you experience, right? So we all experience things differently. That's why I always say it's important to speak to a therapist, because you may not even know like if you're handling it well, because also now we also handle things because of how we've been raised. If I see that my folks coped with their stress by working more, then that's what I'll do, because that's just what I've been conditioned to believe.
Okay. I think you've said it's, and we know now that it's important to see a therapist, whether or not you're in the thick of it. But now, like, for real, when do I know when to seek professional help? But also, how do I know who to go to? Because, we have the psychiatrist, we have the therapist, and we have
life coach.
Yes, we have a life coach, counselors, exactly.
It's actually a lot.
There are many, and it's
I
like,
love it,
okay, seek professional help, but like, okay, who do I go to? Also, I think I'll tie this in with, you see, now, as I said, with my experience, the first person I was sent to was a psychiatrist, and me, I was like, I don't know, I was doing anything to just get me out of that state. And I went straight to a psychiatrist, and after assessment and all that, my diagnosis, and then I was put on medication. And then now it helped for a while. But then now years down the line is when I realized, okay, I've treated this thing medically, but I've not dealt with the root cause of, like the psychological aspect of it and such. And so I was still experiencing like anxiety here and then, didn't really know how to manage it, didn't have the tools. So now eventually, years down, is when I started seeing a therapist. And now after seeing a therapist, I was like, hey, if I combined this back then, this would have actually probably, been good. But it's just like, so how do I know who to see and when?
That's a great question. I think the first thing, knowing when to seek professional help, is, let's say you have your own self-care practices, but they're no longer working. Like you genuinely feel like umefika mwisho, now that's time to see a professional. And also, like, it doesn't even have to be that you've gotten there. It's just in the having awareness of how much range a therapist can help you with, then you can easily just, I usually say, like, the minute you have the thought, honestly, just that appointment. There's a reason why. There's a reason why your intuition is also telling you. And I always like to tell people, like, learn to trust your intuition and your gut, because you'll always know when something is, even for you, I'm sure by the time it got to there, you were seeing some warning signs, maybe feeling very anxious, so I'm usually like, don't wait for it to get there. The same way we like advise people to go to like medical doctors, like, don't wait until, same thing. Just think of it as a mental checkup. The same way you go for a physical checkup, same way you take your car for service, you're taking your mind. So when you feel like something is off, just go ahead. And also like, it can be an exploratory session. It can just be, I'm feeling off, can you help me figure out what's going on? So it doesn't have, it's not a death sentence. It doesn't mean like now that you've come, you're going to get a mental illness diagnosis. No, it can be, we can explore what's actually going on to help you understand. And there's people who come to therapy for self-awareness. Like, you just want to learn more about yourself and your core beliefs.
Okay, interesting. So when I see a therapist, will the therapist maybe now refer me to a psychiatrist if they feel like there's need be? Or like, how does that work?
So the term therapist, I feel that now is used as an umbrella term.
Okay.
So maybe let me get a bit more technical in terms of training, because education is what separates all of us. So I'm a psychologist. So you study psychology in uni. And so ideally, psychology it's like 4 years, I think, for everyone. I don't know. It's like 4 years. I hope. I would hope.
Yeah.
So now in psychology, you're taught how to hold people's pain in varying lengths, and you also learn about disorders and everything. So essentially, a therapist is a psychologist. When I left it, but sometimes I feel like, hey, these terms are many.
There are many. That's true. That's true.
So essentially, a therapist is a person that you go to when you're experiencing like mental health struggles, or even mental health conditions. You wouldn't know if you have a mental health condition until, and so there's counseling psychologists, there's clinical psychologists, and so a clinical psychologist is more leaning towards like the clinical side of things. So like when you have a mental health disorder, or when you have a mental illness, and then counseling is for now like day-to-day issues and everything. And then now there's a counselor, just a counselor.
Yes, a counselor. Yes.
So a counselor, I don't know if it's a degree or a diploma. It's a diploma. I'm not wrong, please. It's not for me.
Yeah.
But like there's a counseling diploma, but then there's also counseling psychologists who have done a degree. So now, but a counselor, which more often than not you find in different scenarios, school, churches, others have their own practices. So now this is who you go to when you have like day-to-day stressors, not necessarily clinical or medical in that sense. So just day-to-day issues, sometimes also like when you need short-term
solutions.
Not solutions.
Chats. I don't know.
Short-term help for your mental health. And then a psychiatrist is now someone who went to medical school and then now specialize in psychiatry. So that's a medical doctor. A psychiatrist is a medical doctor, and now that's who prescribes medication and also helps with now diagnosing mental illnesses as well. And then now there's life coaches who also have their place in the mental health field, and I hate how much hate there is to like life coaches sometimes, because I feel like there's a place there's nakuanga na mambo. Nakuanga na mambo.
I think the thing just to interrupt a bit, it's just like, okay, for a life coach, I mean they do a good job, but I think the thing I usually wonder, it's like, this life we are living it together. It's not like you've lived before. I see. So like, how do you become a life coach? You get,
I know, I see what you're saying. So like there's actual like certifications in like being a life coach. So that's a certification, right? I don't know if there's a degree in life coach, I'm not sure. But so because I was just breaking it down in terms of education. But now a life coach is who you go to when you're looking for motivation. Or help in seeking like goals, or like clarifying your goals and everything. So my issue is usually when we mix up the roles, right? Like when you go maybe to a life coach when you're like experiencing mental illness, and it's just like, okay, I think maybe let's see a psychiatrist and a therapist, right? And then also sometimes coming into therapy and you're struggling with finances, and we walk through your money mindset and like maybe financial trauma, then at that point maybe see a financial coach, because I'm not going to tell you invest in this MMF so I think it's just the whole wellness field. In fact, I'm always calling for more collaboration within the field, because there's a place where like for my clients I'll be like, okay, now I think you can see a financial coach. I think you can,
I mean, there's only so much you can do as well. And then now they come in to complement what you're doing.
And it's the same way now, psychiatrists, like, I like to work with psychiatrists as well, because it's like, okay, so you have done this part for diagnosing, prescribing medication, then now they need to be in therapy. Just what you were saying, you saw a psychiatrist, but you felt the need for therapy. So it's just about they all work hand in hand depending on what you as a person want.
Okay. All right. Thanks for that. So now we've learned who all these, different people are and the roles that they play and stuff. So now let's assume this is Vanessa, the one back in 2019, or even just someone who needs, like, they feel like, okay, now I need professional help, but you're actually nervous. It's not it's not an easy thing. It's not, and I think one of the reasons why, despite knowing something was off, I never actually sought help, because it was like, I know what are people going to say, but it's like, hey, is it that serious? It's never that serious. But I also look back, I've also just remembered there's a period I had in around 2015, 2016. And this was after a number of losses I'd had. And now at that point, the most recent one being my mom and then now my uncle. And I knew, thank you. Thank you. But I knew for sure, at that point, I knew for sure I needed help. I went to my dad and he was like, yeah, let's look for someone. And he looked for someone and I think it was more of a counselor. And then I was just like, yeah, I'm not doing this. There's no way I'll sit down and start like opening up to someone. That was like back in 2016, 2015. Then in 2016,
was it those religious ones?
It was, but I never even had a session. I never even bothered. Yeah, I never did. I never did it. I chickened out before I actually had to do it. And then the time I had a mentor around 2016, and we had the same conversation. I think you could say she was kind of like a life coach actually to some extent. And then she was like, it might be good if you saw someone like a counselor. And I remember she gave me contacts where I should go, and I went, I got in, I inquired at the reception, and then they're like, okay, we can get someone to speak to you. Then now you understand like exactly who to see. And I sat there at the reception, I looked at that place, and I was like, yeah, absolutely not. I left even before I saw someone. This was back in 2016. But you see, it caught up with me later. But the thing is, what I'm trying to bring out is like we actually get quite nervous when it comes to such things. So like, what would you tell someone who has realized that I actually do need to seek professional help, but they're scared of making that first step?
Just make it scary. Like you're not alone for feeling scared to want to seek help. Like I think even I still get a little bit scared, especially when I haven't done what my therapist kind of like, you know.
You've not done your homework.
I go, I'm like, oh, you know. And I think as with anything in life, there's so many things we'll always be nervous about. There's so many things, but does that mean like you shouldn't do it? You know. So even outside of therapy, I always say do it scared. Just do it. Because at the end of the day, this therapist is here for you. Like imagine this hour is a space for you. So even when you think about it like that, it makes you a little bit like just calmer, because this is a space for you. A therapist is there to hold your stories with all the comfort and all the empathy and kindness, and just someone there to listen to you. So if you think about it in terms of that, it's like, yes, you're gonna share a lot of things, but this is a confidential space. For example, like first of all, there's nowhere it's going. It's a professional who has been trained to help you with exactly what you're going through. So then it just becomes like, when you really think about it that way. So that's how even I tell a lot of my clients from the first session, I'm like, just know the space is yours. It's yours. It's a safe space for you. It feels a lot more comforting when you think of it as that. And I understand we've experienced judgment from society, even from like doctors sometimes, you know, like we've experienced judgment, even from therapists. I know that too. So just think of it as someone who's non-judgmental, who's there for you. And then even in the pursuit of looking for a therapist, shop.
It's like window shopping.
Have a call, find out if they offer a call before, talk to them. Your intuition
will never lie.
It will never lie. You need to feel safe with someone. Therapy doesn't work if you don't trust your therapist.
That's true.
Therapy does not work if you don't trust your therapist. So also that's another thing. I feel people maybe rush into the process of getting into therapy because you want to get into therapy, but you haven't done your research. You see how like sometimes you just had, you know, talk to that therapist first. I always insist, talk to them. How does your spirit feel with them? And then also, are they trained in what you want to like actually deal with? Because maybe this person is like a trauma therapist and you want to deal with something else, and then you know, so really I always ask like, what do they even like helping people through?
Oh wow, that has made me realize actually I mean, I never really asked that when I started therapy, or like I didn't find out exactly what they specialize in. It was, I just started and I was like, and then I just laid
I asked. In fact, I actually even have a video on my Instagram for like questions to ask when you're looking for a therapist. Because people don't also know. I don't think we've been taught to interview like anyone in like the medical field. So just ask, ask all the questions, because you're paying for it, one. Two, you're gonna share a lot of things. So make sure that you feel safe.
It's true.
Always make sure that you feel safe around this person, and don't be afraid to end the journey if at all you feel that it's not working for you.
That's actually quite spot on, because now I'm seeing, like, you see, if I go to a doctor, I just won't always go to a general physician. If I have reproductive health issues, I'll go to a gynecologist, because that's what they've specialized in. If I have, I don't know, is it like tummy issues, I'll go to a
gastroenterologist.
You know, so those kind of things.
Go to an optician if
exactly, it's my eyes. For my teeth, I'll go to a dentist. So, you know, if I'm looking for a therapist, I'd rather go to someone who has specialized in whatever issue I'm trying to.
Exactly. And then also now there's like different modalities that we use as therapists. There's someone who uses CBT, there's someone who's a somatic practitioner. So it's also now like, I always say it's upon you to even like look for this information, because it's, I mean, on my page.
Plug?
No, I have to plug myself.
Yeah, plug yourself.
But like all this information, like actually seek information about what you're supposed to be looking for when you're looking for a therapist, because you also don't want to jump from therapist to therapist, sharing your story here, there. So just know like about this therapist, maybe search on LinkedIn. I'm sure he's so keen. No. And then now the good thing is therapists now are registered and licensed, so you could also like ask about that to make sure that you're getting the best care.
Okay. I mean, I'm lucky that the therapist that I ended up with, just like we clicked and they were able to help me navigate whatever struggles I had then. But yeah, I think it's very important to do that research, and I started learning or seeing that much later now, like from when you post and when now other people talk about it a bit more. But I'd like to take you back a bit to something you mentioned briefly. You mentioned something like CBT and
somatic.
So if I'm not wrong, CBT is like cognitive behavior. Actually, I know things, guys. I know things.
You do.
But yeah, please, for like, if you're not like very conversant to that, what would you define that as?
It's cognitive behavioral therapy. So it actually is it the study? How do I describe CBT? But essentially, CBT looks at how certain events happen and how now they influence your thoughts, your feelings, and your behavior. And then now through that, you're able to now learn how to reframe your thoughts. For example, like if you're having persistent negative thoughts, like how can we reframe that so that you can start to experience more positive thoughts, which will in turn influence positive feelings, positive behavior. So at the basic, it's that. Yeah. Then there's also like trauma-focused CBT, which is now what I practice, not just like CBT blame, but now trauma-focused now focuses on how that trauma affected all of those processes and how can we now heal through that as well.
Okay.
And then somatic experiencing is more looking into the body. So the thing about talk therapy is like, we'll talk about what's on your mind, but then we need to deal with what's going on in your body. You know that statement for like, you feel trauma in your body, or your body remembers. It's true. Your body does remember. So sometimes you find that your body is stuck in fight or flight or even freeze and you don't realize it. So it's a lot of breath work. It's a lot of breath work, a lot of connecting with your body and releasing literally all the tension and trauma stored in your body. So actually, I think I just maybe was talking more about what I do, because I do somatic and like CBT. And there's different ones. There's like dialectical behavior theory, which is DBT, and that focuses more on like emotions, emotional awareness, emotional regulation. So it's also not just like therapists don't just look at one thing as well. So like you may find that you have not all, but like a couple of modalities that you use, because it's not just one. I think you've given us like what to look out for when you want to start therapy, how to even interview your therapist. I think for me, what I can say, one of my motivations usually is, I think of like, I'm paying
I am paying for this session, so I will make use of this session. I will ask all the questions that I need to ask, and I don't say milk, but milk this session, kabisa.
It's important because, like you said, you're paying. It's important to get the most out of your therapy experience because you also like kind of fasten your healing journey rather than just coming and or you haven't done much, or it's like, no, like, be active, be an active participant in your life.
At the end of the day, you also want to be better.
Exactly. So it's like, because it's not just my job. Like, it's my job, yes, but it's not just my job for your healing. A client also needs to now put in their own work as well.
I've just remembered something that happened sort of when I was starting to do this therapy thing, and as I've said, it can feel very uncomfortable at first, especially if you're not someone who usually opens up a lot. But then there's also the thing, the way you were saying, everyone gets nervous even after you've already started and you're in it. You've probably already made a connection with your therapist, but and then they give you an assignment to do, or like homework, or they tell you to do something, and then you go and you haven't done it. So there's still so many things that come into play when you're having a therapy session. And I remember now when there's a therapy session I had, and I think they were asking me some hard questions and I'm just like and I think I even said it out loud, because I have this thing where I say myself out loud, and I was like, I hate therapy so much. But I don't actually hate it, but it's like I kind of hate that it's making me unearth, or let's say unearth these things. But the whole point of it is to heal, to get better, and I can't do that if I keep concealing or if I keep holding back and such. So I think maybe essentially what I'm just trying to say is therapy is good. I'm not saying it's easy. It's definitely not easy.
No, it's not. And I always encourage people to not see it as now you go for the first session and you said everything. No, like
you have to lay down all your problems.
Really, just 50 minutes to an hour.
And you can't solve it in that first session.
No. So even like the first few sessions are literally just building rapport, building a relationship. You find that people will open up at the third session or the fourth, or sometimes find someone that the first session is ready. So that's the thing about therapy, like wherever you are in your journey, even if you're still struggling with being vulnerable, it's fine. It's just, do you feel safe? Do you feel safe with this therapist? No one is going to rush you, especially even with trauma. I can't what happened? Tell me now.
Lazima uongee.
No, it's not like that. It's at your pace. We literally take it as your pace. At your pace. And sometimes even with my clients, I'd rather maybe focus on, let's say, self-care or emotional regulation, and we build those skills, and then now you start opening up. So it's also not, you're coming to also a professional. They won't just like sema kila kitu sasa. So it's also like you won't be expected to come bear everything, in just one session. Like it's a stranger. We're strangers to each other. And I always ask clients, like, do you feel like you want to ask me anything personal? I'm always with boundaries, of course. I will answer like, no, I like my clients to also know me a little bit more, so it's also like you can open up, you can ask your therapist. In fact, when you haven't done like your homework, I like to explore the why, not why you didn't do it. I mean, not that you didn't do it, but like, okay, what was the resistance for not doing your homework? Did you feel like it was challenging? Did you feel like we're going too fast? Would you like me to like do it with you in session? So it's
okay.
I
like that.
Actually,
now how touch up
in fact, I don't like to call it homework. Actually, in my practice, I don't call it homework. It's reflection.
It's reflection.
It's not homework, because homework makes you feel like
it brings back that
kind. Exactly.
Trauma, especially if you're in 844. You see, there's trauma there also. We all need therapy. All right. So as we wind up, you've mentioned self-care a bit, but how would you say, or rather, what would you say are small ways that we can prioritize our mental health on a daily, so that we don't even end up in that like crazy position? I'll always use that as a reference point for myself. I mean, it was for myself, but because you can learn something from it. But yeah, definitely. How can we prioritize our mental health every day? Yeah.
Mindfulness. I think I preach mindfulness everywhere I go.
Yeah.
And mindfulness is essentially just being present through life. Like when you're having your morning coffee, are you taking time to like even savor the taste? Are you taking time to look around you? All your senses, are they fully engaged? So that's one thing I always say, like, everything that you do, moment to moment, fully engage in it. That phone call, fully engage in it. That meeting, fully engage in it. Then when you move to the next thing, be present through it. Because most of the times we're just here.
Yeah, we live in our heads so much.
We live in our heads so much, And then self-care. So from your physical self-care, movement, physical movement, feeding yourself regularly when you're hungry, hydration, the basics of like physical self-care, social self-care. Hang out with the people that you enjoy, not the ones that make you feel bad, but yourself.
Or drain your energy.
Or drain your energy. Emotional. Are you taking time to like listen to how you're feeling? You know, I mean, people say journaling, but there's so many different ways of journaling. You can do a voice note to yourself. You can record a video. You know, but have time of reflection. The idea of journaling is reflection. Journaling is just one way. So have time to reflect as well, and set boundaries. That's an emotional
boundaries.
Set healthy boundaries, not rigid, strict ones. Healthy boundaries. But I would say the one thing for sure is like mindfulness.
I
Like really be present through your life. Allow discomfort will happen, but the more you allow yourself to feel it, the faster, honestly, like it goes away. Like truly,
that's
feel
true.
it, release it. Rather than keeping it and then you're just angry.
All right, that's beautiful. Thank you. And if you could give just one piece of advice to anyone who's struggling in silence, what would you tell them?
Reach out to your friends, reach out to a hotline. There's so many hotlines. Reach out to a professional. Like, reach out. You're not alone. Like, you're not alone. All of us are struggling. I have struggled. All of us are struggling in different ways, in one way or another. And you're not weak. You're not weak. You're not weak. In fact, there's a lot of strength in your resilience. So reach out. There's people that are ready to help you.
Oh, that's beautiful. Thank you. So lastly, please tell us where we can find you on social media. You know, I'm sure people would be curious. So like, where would they, like, if they'd also like to learn more how to seek help and also just interact with your content? So Melissa Kioko is where I'm like primarily creating content on Instagram. Trying to focus on TikTok, but it's Mel Kioko, but there's not much happening there. But so Instagram, Melissa Kioko. Thank you, guys. Please do follow. She usually drops some gems, so I've learned quite a bit from it, and I'm sure you will as well. Thank you so much, Melissa. I've really enjoyed this conversation.
Yeah, me too.
I've also learned a lot.
I'm glad.
Quite a lot. And
my teaching dreams.
You see, you're doing well. You're doing well. If you needed a sign, this is it.
I have it now. Thank you. Thank you for having me.
Thank you so much. And thank you, guys. Thank you for listening. I was your host, Vanessa Wanjiko Kanyaru on all social media platforms. Please be sure to like, also leave a comment also on if you have any questions for our therapist or any directed specifically to Melissa. If you'd like to learn more about therapy or anything really. If you've learned something or got some insights, please also share them on the comment section. We'd love to hear from you as well. Thank you for listening. Thank you for joining us today. And have I said subscribe? Yeah, subscribe if you haven't. And also share it with someone who you think would benefit from this. Thank you.
Bye.
Bye.